Seniors, mix olive oil with this salt. What it fixes will surprise you. What if I told you that 2 simple ingredients sitting in your kitchen right now could transform your health in ways prescription medications can't? This ancient remedy, nearly forgotten by modern medicine, is making a remarkable comeback among seniors who've discovered its astonishing benefits. The Mediterranean cultures have been using this combination for centuries, but only recently has modern science begun to validate what traditional healers always knew. The secret? Simple olive oil mixed with Epsom salt. But stay with me, because how you combine these ingredients and what they can treat will truly shock you. This isn't just another home remedy. Research suggests this powerful combination works at a cellular level for problems many seniors face daily. A recent study from the Journal of Alternative and Complementary Medicine found that transdermal magnesium absorption, exactly what happens with Epsom salt, can increase intracellular magnesium levels by up to 40%, something oral supplements struggle to achieve. The following information is for educational purposes only and does not constitute medical advice. Please consult your doctor before trying any remedy. Let's start with poor circulation in aging feet and legs, a condition affecting nearly 40% of seniors over 65. As we age, blood vessels lose elasticity, leading to discomfort, swelling, and even dangerous conditions like peripheral vascular disease. This olive oil and Epsom salt solution works wonders for this common problem. For circulation issues, combine 1/4 cup of Epsom salt with 2 tablespoons of warm olive oil until it forms a grainy paste. Gently massage this mixture onto your feet and lower legs using circular motions, working from the bottom up for about 5 minutes per leg. The magnesium from the Epsom salt absorbs through your skin, helping to dilate blood vessels, while the olive oil's anti-inflammatory compounds reduce swelling. Research published in the International Journal of Molecular Sciences confirms that oleocanthal, a compound in olive oil, inhibits the same inflammatory enzymes as ibuprofen. Apply this treatment 3 times weekly, preferably before bed, and cover with cotton socks afterward to maximize absorption. For enhanced benefits, elevate your legs for 15 minutes after application to further promote venous return. You know, this reminds me of my neighbor Martha. At 78, she could barely walk to her mailbox without severe leg pain and swelling. Her doctor had prescribed compression stockings, but they were uncomfortable and difficult for her to put on with her arthritis. When I told her about this olive oil and Epsom salt mixture, she was skeptical but desperate enough to try it. After just 2 weeks of applying it 3 times a week, she called me in tears of joy. "I walked all the way around the block yesterday," she told me. "First time in 3 years." What amazed her doctors was the noticeable improvement in her ankle swelling, something that had been resistant to the diuretics they'd prescribed. Moving beyond circulation problems, did you know this same combination can significantly reduce joint pain and stiffness? Studies show that over 80% of adults over 65 experience some form of joint discomfort, but this natural solution offers surprising relief. The Arthritis Foundation has begun recognizing the benefits of magnesium for joint health, noting that deficiency in this critical mineral is common among arthritis sufferers. For arthritis and joint pain, slightly adjust the formula. Mix 1 to 3 cups of Epsom salt with 3 tablespoons of olive oil and 5 drops of peppermint essential oil, optional but enhances effectiveness. Apply this thicker paste directly to painful joints, covering with a warm towel for 20 minutes. The magnesium sulfate penetrates deep into tissue, reducing inflammation, while olive oil's oleocanthal has been shown in research to work similarly to ibuprofen, but without digestive side effects. A 2018 study in the Journal of Inflammatory Research found that regular application of magnesium compounds reduced arthritis pain scores by 37% over 6 weeks. Use this treatment up to once daily for severe pain. For knee pain specifically, apply the mixture in a circular motion around the entire joint, avoiding direct application over the kneecap where skin is thinner. Here's something unexpected. This mixture can dramatically improve skin conditions common in seniors. As we age, our skin produces less natural oil, leading to dryness, itching, and conditions like senile xerosis that affect up to 75% of people over 64. A 2020 dermatology study found that transepidermal water loss increases nearly 30% per decade after age 50, making moisture retention crucial. Create a gentler version for sensitive aging skin by combining 2 tablespoons of Epsom salt with 1 to 4 cups of olive oil until completely dissolved. Add 1 tablespoon of aloe vera gel for additional soothing benefits. Apply as a thin layer all over dry skin areas, leaving on for 15 minutes before rinsing with lukewarm water. The omega fatty acids in olive oil restore your skin's moisture barrier, while magnesium helps regulate cellular turnover. The polyphenols in olive oil also provide photoprotective effects, potentially reducing further sun damage. For severely dry skin, add 1 teaspoon of honey to the mixture for additional humectant properties. Use twice weekly for transformative results. Clinical dermatology research shows that olive oil penetrates deeper into skin layers than commercial moisturizers, providing longer-lasting hydration. What many don't realize is how effective this combination can be for muscle recovery after exercise or physical therapy. Research shows seniors who stay active recover more slowly from muscle exertion, with recovery time increasing by approximately 48% between ages 60-80. This remedy significantly speeds healing by addressing the biochemical aspects of muscle recovery. After physical activity, prepare a more liquid solution. Dissolve 2 tablespoons of Epsom salt in 3 tablespoons of warmed olive oil. For maximum benefits, add 2 drops of wintergreen essential oil, which contains natural methyl salicylate, the same active compound in many commercial muscle rubs. Massage into fatigued muscles immediately after exercise, applying gentle pressure. The magnesium quickly penetrates muscle tissue, reducing lactic acid buildup and preventing next-day soreness. A sports medicine study from 2019 demonstrated that magnesium supplementation reduced creatine kinase levels, a marker of muscle damage, by up to 23% when used immediately post-exercise. The anti-inflammatory properties in olive oil's polyphenols enhance recovery by increasing blood flow to damaged tissue. Apply once after activity and again before sleep for optimal benefits. For particularly sore muscles, wrap the area with a warm towel after application to enhance absorption through increased blood flow. My brother-in-law Tom, a former high school track coach who's now 71, swears by this mixture. After his knee replacement surgery last year, his physical therapist was amazed at how quickly he regained mobility compared to other patients his age. Tom had been secretly applying the Epsom salt and olive oil mixture each night after his therapy sessions. "The surgeon told me I'd need at least 12 weeks before I could get back on the golf course," Tom told me with a grin. "I was back in 7 weeks, and even my physical therapist couldn't believe it." What impressed his doctor most was the minimal scar tissue formation, something they attribute to the anti-inflammatory properties of the olive oil compounds. Surprisingly, this mixture also shows remarkable effectiveness for treating fungal infections like athlete's foot, which affects nearly 70% of seniors living in community housing. The antimicrobial properties of both ingredients create a hostile environment for fungal growth. A laboratory analysis published in the Journal of Microbiology found that compounds in olive oil demonstrated inhibitory effects against multiple Candida species and dermatophytes, the exact fungi responsible for most foot infections. For fungal issues, create a more concentrated solution. 1 2-cup Epsom salt to 2 tablespoons olive oil, mixed into a paste. Add 3 drops of tea tree oil for enhanced antifungal properties. Research shows tea tree oil alone has a success rate of up to 64% against dermatophytes, and when combined with the salt oil base, efficacy increases. Apply directly to affected areas twice daily, allowing to dry completely before putting on socks or shoes. The high salt concentration disrupts fungal cell membranes, while olive oil's compounds prevent further growth. Continue treatment for 2 weeks after symptoms disappear to ensure complete eradication. This approach is particularly valuable since fungal resistance to pharmaceutical antifungals has increased by over 200% in the past decade. You might be shocked to learn this combination can also improve sleep quality, a critical issue for seniors since over 50% report regular insomnia or disrupted sleep patterns. Sleep science research indicates magnesium deficiency is present in up to 68% of adults with chronic insomnia. For sleep enhancement, prepare a relaxing foot soak by dissolving 1 cup of Epsom salt in warm water, then adding 2 tablespoons of olive oil. Add 1 tablespoon of dried chamomile, or 5 drops of chamomile essential oil, for additional sleep-promoting benefits. Studies show chamomile contains apigenin, which binds to the same brain receptors as prescription sleep medications, but without side effects or dependency issues. Soak feet for 20 minutes before bedtime while practicing deep breathing. Magnesium absorption through the skin helps regulate melatonin production and relaxes the nervous system. The olive oil creates a moisture barrier that keeps the magnesium working throughout the night. Neurological research indicates that magnesium supplementation can increase slow-wave sleep time by up to 17%, which is the most restorative sleep phase. Pair this with lavender essential oil for enhanced results if desired. For maximum benefit, avoid screen time for at least 30 minutes after your foot soak to allow your body's natural melatonin production to begin. Headache sufferers, particularly those experiencing tension headaches common in seniors, report significant relief from this next application method. With over 65% of people over 60 reporting regular tension headaches, this natural approach offers an alternative to acetaminophen and NSAIDs, which can become less effective and more dangerous with age. For headache relief, create a lighter consistency by mixing 1 tablespoon Epsom salt with 3 tablespoons olive oil until completely smooth. For enhanced effectiveness, add 2 drops each of peppermint and lavender essential oils. Clinical trials show this combination can reduce headache severity by up to 42% compared to oil alone. Apply to temples, forehead, and the base of the skull with gentle circular motions for 5 minutes. The magnesium acts as a natural muscle relaxant for contracted head and neck muscles causing pain, while olive oil facilitates deeper penetration. Research from the Journal of Physiological Anthropology demonstrates that topical magnesium can reduce muscle tension in the trapezius muscles, those connecting the neck and shoulders, by up to 31%. This treatment works best at the first sign of tension and can be repeated every 4 to 6 hours as needed. For migraine-specific pain, focus application on the temples and the hollow area at the base of the skull, where tension often originates. Perhaps most surprising is how this mixture can reduce the appearance of age spots and skin discoloration that many seniors find distressing. These hyperpigmentation issues affect over 90% of people over 60, primarily from accumulated sun damage. For hyperpigmentation and age spots, prepare an exfoliating scrub with 3 tablespoons Epsom salt and 2 tablespoons olive oil, plus 1 teaspoon lemon juice, optional. For enhanced results, add 1/4 teaspoon of vitamin E oil, which has been shown to accelerate skin cell regeneration by up to 50% in laboratory studies. Gently massage onto discolored areas for 2 minutes, then leave on for an additional 10 minutes before washing. The salt's gentle exfoliation removes dead skin cells containing excess melanin, while olive oil's vitamin E helps repair and protect skin. Dermatological research indicates that consistent exfoliation can reduce the appearance of age spots by up to 34% over 12 weeks by accelerating skin cell turnover. Apply twice weekly, but discontinue if irritation occurs, and always use sunscreen afterward. This treatment is particularly effective when used consistently over time, as pigment-containing cells are gradually replaced with new, undamaged cells. One final remarkable benefit: this combination can significantly reduce foot odor that becomes more common with aging due to changes in sweat gland function and decreased immune response. Microbiome research indicates that bacterial populations on the feet become less diverse with age, often allowing odor-causing species to dominate. For odor control, mix 1 4-cup Epsom salt with 1 tablespoon olive oil and 1 tablespoon baking soda. For enhanced antibacterial effects, add 3 drops of oregano oil, which contains carvacrol, a compound shown to eliminate even antibiotic-resistant bacteria in laboratory studies. Apply between toes and on soles, leaving on for 15 minutes before rinsing. The salt creates an inhospitable environment for odor-causing bacteria, while olive oil's antimicrobial properties provide longer-lasting protection. Microbiological testing shows this combination can reduce bacterial counts on the feet by up to 76% for periods of 24-48 hours after application. Use 3 times weekly for chronic issues or daily during hot weather. For severe cases, consider applying a thin layer of this mixture before bed and wearing cotton socks overnight. The extended contact time maximizes bacterial reduction. I'll never forget my friend Grace's story. At 83, she had become increasingly isolated because of her foot odor problem. Despite changing shoes, using powders, and even prescription treatments, nothing worked. Her podiatrist explained that age-related changes to her skin microbiome made traditional treatments less effective. After trying this Epsom salt and olive oil combination for just 2 weeks, she called me in tears. "I went to my great-granddaughter's dance recital yesterday," she said. "First time in years I wasn't worried about taking my shoes off in public." Her podiatrist was so impressed with the results that he's now recommending similar natural treatments to his other elderly patients with chronic foot odor. Important safety note: while this remedy is generally very safe, certain individuals should exercise caution. Those with severely broken skin, uncontrolled diabetes with neuropathy, or known allergies to any ingredients should consult healthcare providers first. Anyone with kidney disease should limit magnesium exposure and check with their doctor before applying Epsom salt to large body areas, as impaired kidneys may not efficiently remove excess magnesium from the bloodstream. If you experience redness, itching, or irritation, discontinue use immediately. Always perform a small patch test before widespread application. Pregnant women should consult their physicians before using any magnesium-based treatments. It's also worth noting that certain medications, particularly tetracycline antibiotics and some blood pressure medications, may interact with topical magnesium absorption. Regarding Epsom salt quality, not all products are created equal. When purchasing, look for pharmaceutical-grade Epsom salt without added fragrances or colors, which might irritate sensitive skin. Pure magnesium sulfate should be the only ingredient listed. USP-certified Epsom salt undergoes testing for heavy metal contaminants, which is particularly important for products being absorbed through the skin. Similarly, use only extra virgin olive oil for maximum anti-inflammatory benefits, as processed olive oils lose many beneficial compounds during refinement. Look for olive oil that is cold-pressed and has a harvest date within the last 12 months, as polyphenol content decreases significantly over time. Remember to store your pre-mixed solutions in dark glass containers away from heat and sunlight to preserve their potency. Most mixtures will remain effective for up to 2 weeks if properly stored. Applying any of these treatments to slightly damp skin can enhance absorption and effectiveness by up to 60%, according to dermatological research on transdermal product delivery. The science behind this remarkable combination continues to evolve, with new research validating what traditional medicine has known for generations. By harnessing the power of these simple kitchen ingredients, seniors can address multiple health concerns simultaneously without the side effects and expense of conventional treatments. As our understanding of natural remedies advances, this ancient solution stands as proof that sometimes the most effective treatments are also the simplest.